KTLA 2015, and there has been breaking news on the recent Ebola epidemic coming straight from CDC epidemiologist Joy Ngula.
Thank you, Perch. There has been a recent spike in the death rates in Guinea, Sierra Leone, Libya, and Nigeria as of March 2014. It is the purest strand of Ebola affecting these regions. There has been about 1,603 cases reported with above 55% dead, which is about 800 people. CDC assisted the Ministry of Health in the epidemiologic and diagnosed aspects of the outbreak. Testing of samples by CDC Viral Special Pathogen Branch occurred at UVRI in Etimbe ongoing outbreak across Liberia, Sierra Leone, and Nigeria. Number of patients are constantly evolving due to the ongoing investigation. Back to you, Perch.
Such high numbers. Thank you, Dr. Ngula. For all of you at home unaware of the recent Ebola outbreak, KTLA 2015 has gotten in touch with historian Elizabeth Gonzalez to shed some light on the situation.
Thank you, Perch. Actually, one of the earliest cases of Ebola was found in Sudan in 1976, where it was commonly known as the Ebola hemorrhage fever. The reason why today we are paying more attention to it than the years before, it's because it's one of the most dangerous out of 5 species of Ebola called Z-bomb. Z-bomb has infected more people today than it has back in 1976, where it was first discovered near the Ebola River. Right in the Ebola River, it infected 284 people, leaving a mortality rate of 53%.
Yes, very good, historian Gonzalez. I understand there's more species. Could you tell us a bit more of their origins?
Yes, well, the second Ebola virus emerged from Yambuco. They're commonly referred to as Ebola Zaire or EBOLA. EBOLA is the highest mortality rate of any of the Ebola viruses, infecting 318 people. Despite the tremendous effort of experienced and dedicated researchers, Ebola's natural host has never been identified. The third strain of Ebola, or otherwise known as Ebola arrestin, was discovered in 1989 when infected monkeys were imported to Western Virginia from Mindanao, Philippines. Fortunately, those few individuals who were infected never developed the Ebola hemorrhage fever. The last strain of Ebola that's been known is Ebola Cote d'Ivoire or EBOCI, discovered in 1994 when a female epidemiologist performing a necropsy on a chimpanzee from type 4 accidentally infected herself. This year in 2014, Ebola has spread into the Midwest, Africa's major population centers like Guinea, Liberia, and Sierra Leone, but it's not uncommon in the Republic of Congo.
Fascinating. KTLA 2015 also has footage of historian Gonzalez in Liberia, one of the most heavily infected regions.
You guys ever worry about Ebola, even think it's real? Ebola's not real. The government said that we shouldn't eat bushmeat. If Ebola was real, a lot of people would be dead.
But hasn't 7 people already died in Monrovia?
Could have been anything. An infection wound, or even a bad case of gas.
Back to you, Perch, in the studio.
The locals are only perpetuating the disease's rampage. Truly disheartening. I'm just getting reports that we have some more information on preventative measures and treatments from WHO Dr. Mariana Alfaro.
Yes, thank you, Perch. In order to transfer the virus, you need to have direct contact with the blood or secretions of an infected person and exposure to objects that have been exposed to the virus, such as needles.
Is there any way to prevent this disease, Doctor?
As of today, there are no vaccines that can prevent the Ebola virus, but as an experimental treatment, the MAP Pharmaceutical Incorporation is developing a vaccine called ZMAP. ZMAP will only be used for individuals infected with the Ebola virus. but it has yet to be tested on humans for effectiveness. In order to prevent the Ebola virus, some techniques are wearing protective clothing such as masks, gloves, gowns, goggles, etc., as well as isolation of Ebola-infected patients and sterilization of infection control measures.
Thank you for those crucial facts. We have one more official before we go off air, and that's the devilishly handsome TSA official, Kayla Israel. Kayla?
Well, you're not too bad yourself, Perch. The recent Ebola virus spread to Nigeria through a traveler from Liberia, and on August 5th, the CDC issued an Alert Level 2 travel notice to travelers to Nigeria, notifying travelers of the area to practice careful hygiene and avoid contact with blood and bodily fluids from people ill with Ebola. But there's still a Warning Level 3 travel notice remaining in effect for Guinea, Liberia, and Sierra Leone, advising people to avoid non-essential travel to those countries.
Yes, thank you, Kayla. The last bit of new information is coming straight from Liberia. As of August 17, 2014, there was a reported attack on a Liberian isolation ward, and 29 patients fled. The attack has been confirmed as of today. The witnesses say armed men smashed down the doors and looted possibly contaminated medical supplies, prompting the 29 patients to flee. We are still awaiting further updates. Well, that's it for everything we know here at KTLA 2015, and when we know more, so will you. Thanks for watching, and back to your regularly scheduled programs.